Hi, I'm Dolly Vasta, and welcome to Dolly's World. The word support is the theme of today's show. It's an important word, and I looked it up in the dictionary. And the meaning is to bolster up, to back up, to aid. Now, without going into all the gory details, over the past 4 years, I have had a tremendous amount of cervical and lower back surgery. And although I have had a tremendous amount of support from family and church, friends, my medical crew, there was always that one time or those few times when you were really down and out and miserable that you wanted to talk with one person who had had the exact same thing that you did. But I had no idea where to find one. I went up in the studio to Channel 8 one day, and I was talking about this, and Cindy handed me a folder, and in it was an article on the Friends Health Connection and how it was a one-to-one support group. I was fascinated by it, and I called its director and founder, Roxanne Black. We had such a wonderful conversation on the phone that I decided I wanted to do a whole show on her and the people who surrounded her. But why don't we let Roxanne and these people who are affiliated with the Friends Health Connection speak for themselves. Roxanne, you were 15 years old when you were told that you had a chronic disease that could lead into other serious problems. How do you face that at that age?
Well, I think it was devastating at that age because I'd always been healthy, and suddenly I started suffering from different symptoms, and they weren't sure what it was, and finally I was diagnosed with lupus, and I was told I had this disease that I'd never even heard of before. So it was definitely a challenge in the beginning.
Well, was there a lupus support group at that time?
There was a chapter of the Lupus Foundation in South Jersey, but it wasn't that close to my home. It was about over an hour away, probably an hour and a half away. So that's why I eventually started a lupus support group in my hometown area. And the support group was intended to help people in the Atlantic County area to cope with living with the disease.
So eventually then that went into what is now called the Health Connection.
Well, they're actually two separate things. First, I started the lupus support group in my hometown area, and that grew. And I started that when I was a sophomore in high school, so I was 15. And what happened was, when I was first diagnosed with lupus, I was devastated, and I wanted to find someone else who had the disease who I could talk to. And because there wasn't a support group in my local area, I decided to start one. So I started the Lupus Support Group of Atlantic County, and that grew. And when I was in high school, I used to put together rap sessions, meetings. We had rap sessions every other week, which were like support group meetings. And then every month we would have educational meetings where I would have a speaker come in and speak about the effects of the illness. They'd speak about stress reduction and all kinds of relaxation techniques and all kinds of things about coping with pain. And the support group grew, and we developed a mailing list of about 200 people. But as it grew, we became like a family, but there was still no one my age in the group. And so all of the members I loved very much, and we helped each other through it, but it was difficult for them to relate to a teenager's perspective to the disease, because they were dealing with the illness as it related to their marriage or raising kids while having this illness. And I was dealing with coping with lupus while I was in high school. So we were dealing with the same disease, but from different perspectives. And that was what led me to begin Friends Health Connection, because I really wanted to find someone else who was also in high school, who was also dealing with the side effects of all the medication. Like, I was put on medication that caused me to lose most of my hair, and my face puffed up and all kinds of things. So there were a lot of symptoms to it. So I wanted to find someone else who could relate to the illness from a teenager's perspective. And the purpose of Friends Health Connection, my idea was to connect people on a customized one-to-one basis. So to connect them according to their health problem, but also according to age, according to their symptoms, according to their lifestyle effects and their attitudes and their interests, so that they not only relate to the illness, but the impact that the illness has on their lives.
What were your first steps then in doing this? Because you had not had it set, it was not a preset.
Right. Well, in starting Friends Health Connection, what I did is I got a list of I figured, how do I reach people with health problems? So I got a list of newspapers and magazines and television, radio stations nationally. I got a directory from the library, and I would sit at the library and address envelopes to the different media, and I wrote a letter about my idea. And at that time, I didn't know anything about public relations. I didn't know what a press release was or how to format it. I just wrote a letter from my heart about what I was doing, and I sent it out to the media, and the media picked up on it. And so I did that I started Friends Health Connection when I was 16. So out of my dorm room at Rutgers during my freshman year of college. So I wrote this letter to the media, and a reporter from USA Today called me at my dorm room and said he was interested in doing an article about this idea of connecting people with the same health problems on a customized one-to-one basis. And that's how it started.
Why did the medical profession take an interest in it? They're difficult. You can talk to them or to make changes in their own thinking. How did you ever accomplish that one? Because to me, that's a great accomplishment.
Well, I think that I'm in a unique position in doing this because I started when I was so young. I started when I was, like I said, 16. And first I started out of my dorm room, but then I was personally always in and out of the hospital for so many years because I have lupus myself. So I would run it out of my hospital bed when I was in the hospital. And I really started as a patient and then continued as a professional as I got to know the ropes of how to run an organization. So I think that puts me in a unique position to promote the organization in the medical field because I really started based on what I felt as a patient going through illness and feeling this need and feeling these gaps in service and gaps in support, and also to talking to so many other patients through the years that I was in the hospital with, people who were going through it. And so this organization started based on what I felt and what I saw and identified as the needs going through illness myself. And I think that that's the most compelling thing that you could say to a doctor is that, you know, I felt this need is there. So I started it from a patient perspective, and I think that that's what the medical community has responded to because I was able to point that out from the perspective of someone who's been there. And I also think that the medical professionals, that because I've been doing this for 13 years now, and the medical professionals have seen the impact that it's had on people's lives. And I think that that's really important. We've done different research studies now documenting the impact that this support has had on patients' lives. And when you show the medical professionals, when you could document that something has been effective at helping people, then they've opened their eyes to it. And we've had a lot of medical professionals who've been very supportive.
The Friends Health Connection has many friends. Among them, Andrew Green, CEO of Robert Wood Johnson Health Network.
When I heard about it was that it was a very successful program within Robert Wood Johnson University Hospital. And so it made sense to me that it get expanded to and distributed to other hospitals within the network. There are 7 hospitals in the Robert Wood Johnson Health Network, all in central New Jersey, and we now have it in all of those programs, as well as some federally qualified health centers that are in the network as well.
How many altogether?
There are 7 hospitals, 4 health centers, and the largest elder care provider in the state, as well as Robert Wood Johnson Medical School.
And it goes as far as Atlantic City, because Atlantic City Medical Center is part of it, isn't it?
As part of Friends Health Connection,
right.
It is, but not part of Robert Wood Johnson Health Network. But I've got to say that part of Roxanne's strategy, which I encouraged quite a bit, was that that a program like this can't be held to one network. It really needs to be to all of the hospitals and providers need, that really do need to know about a program like this because it helps so many people.
Well, I know Roxanne feels this way. How do you feel about it going out of state and really becoming maybe eventually nationwide?
I think with the advent of the kinds of technologies, email, that exist now that didn't exist when it first got started, I think that's a real possibility and really lends itself to those kinds of technologies to make connections between people that have the same kinds of conditions and are looking for someone to talk to.
I had the chance to chat with a most enchanting young lady who is a member of the Friends Health Connection. And I think you will find what she had to say most inspirational.
I was in St. Peter's Hospital, and at that time I had my 3rd open heart surgery. And that's when I had found, because I was going there 3 times a week to do cardiac rehab. And I saw this brochure in there from Friends Health Connection and just decided to join.
And tell me about it, because it's a one-to-one support, correct?
Mm-hmm, mm-hmm.
So you met up with someone then who had pretty much the same as you.
Mm-hmm, mm-hmm.
Now, all of the things that we
No. No. No, I think I might have started out, well, when I started, Roxanne gave me a whole list of different people. Not people as names. Person number 1 has this problem, person number 2 has that problem.
Mm-hmm.
And what we did is I wrote to so many of the people that, sounded like somewhat of my problem, and I wrote a letter. Now, since I did not have an address, I had it in an envelope, put whatever this person's number was, sent it to the Friends Health Connection, and they in return would have put the person's name on the envelope and sent it out. And then the person had gotten the letter and again would have written to me, didn't have my address.
I see. So it
was,
always went through to keep it legit, in other words.
And then after, if you had, liked this person, that her and I, or him and I, whoever it is, if he thought, okay, well, Susan, here's my address, and then, but that was up to him or her to give me their address.
Right. It was an individual preference
Right,
then.
exactly.
What did you find that you got out of this one-on-one relationship?
That I'm not the only one that's got this problem.
You said something else to me before, that everyone else probably has something even worse.
Mm-hmm. They
really
have
believe it?
Oh, absolutely. And I mean, like, the people I really feel sorry for is many people, but like Roxanne, or the people who were in cardiac rehab with me, who had lived a certain life, then all of a sudden had, whether it was a heart attack or a stroke or something, and had to completely change their whole life situation, their eating habits, their activities, and everything. So, like, to me, that was...
So to you, you're lucky.
Yeah, absolutely.
For some people with health problems, a support group is more effective for them. Sometimes people find more comfort in speaking with a group. And then for other people, the one-to-one connection can be more effective. It really depends on the person. And this isn't meant to replace support groups in any way or to undermine their value. This is intended to be another form of support, another avenue that people can take to find support. And I think that some people, if it's physically difficult to get to a support group meeting, or sometimes they go to support group and there's no one their age, or there's no one with the same like illness manifests itself in different ways. So there's no one with the same severity of an illness. Sometimes they have different symptoms. So I think that it's really helpful to find someone who not only has the same health problems, but who has the same symptoms, who's been through the same types of tests and surgeries, who's on the same types of medications, who's the same age, who may have similar hobbies and interests. And that's what we try and do. We try to connect people who could really relate to one another, not only the illness, but the effects that illness has on their lives. And I think that illness does manifest itself in so many different ways. Like for me, I have lupus and it affected my kidney function. For other people, they have lupus and it causes joint pain. So the person with joint pain does not necessarily have the same type of effects as someone who has kidney failure because of lupus. So it's really, I think, important to find someone else who could really relate to what you're going through.
Not only that, it would seem to me, and having had 4 back surgeries over the years, and being in chronic pain a great deal of the time, that it's nice to be able to talk to a friend on the phone, just to pick up a phone and make a phone call and talk to someone.
Right.
It can change the outlook for a whole afternoon or an evening. And that is where your one-on-one would come in.
Right. Well, this organization is based on friendship and the premise that a friend can make the difference. And I think those friendships are especially close, extra close, when you've shared this common bond, this common challenge of an illness. And that's the whole premise of the organization, how someone can make a difference in another person's life. Just by saying, I've been there, I understand what you're going through, you know, you could get through this, or it's not in your mind. And you know, all those types of things.
The famous slogan, it's in your mind.
Right, so all those types of things that you need to hear, and that you really are so meaningful when it comes from someone else who's walked down the same path. So I think that's why Friends Health Connection has been so effective, I think, because we connect people who really do relate to each other in such a significant way.
Eileen Nadio, clinical oncology nurse specialist at Robert Wood Johnson, had some very definite and positive views of the worth of the Friends Health Connection and its support system.
I think it's wonderful. I think that you know, with our oncology patients in particular, it's phenomenal. But really, with any patient going through any disease process or surgery or anything, just that support that they get from meeting somebody, even over the phone, that's going through the same things, they can tell them things that we as nurses, even though we see it daily, don't have the personal experience with it.
Do you think this program actually changes lives?
I do. I think that from an oncology perspective in particular, that part of their treatment is to have a real positive outlook on things. And when they're able to speak to patients who have been there and have made it through the storm, that I think that part of it is just exceptional for them.
Andrew, how do you feel this program has helped the hospital fulfill its mission?
Robert Wood Johnson University Hospital has a 4-fold mission statement, and it strives every day to try and reach goals in all 4 areas: in care, medical care, in outreach, in research, and in education. This kind of a program really is a major piece of our outreach. It really touches people. It does connect them. People do talk about it. We have it distributed information about the program throughout the hospital, and it is really taken advantage of by our patients, who are, by and large, some of the sickest folks in the state of New Jersey.
So in that way, everyone profits.
Everybody profits, and that's, you know, this kind of a win-win situation makes it such that hospitals, not only Robert Wood Johnson, but other hospitals in the Robert Wood Johnson Health Network and outside the network support Friends Health Connection.
We're doing a program in New Jersey right now that was funded by the Robert Wood Johnson Foundation, and the program is intended to provide support and education and recreation for for people with health problems and their families, and also medical professionals in New Jersey. So we're working with different hospitals and healthcare facilities throughout the state. And as part of the educational component, we put together a lecture series, and it's a 3-part lecture series. So last year we had Deepak Chopra and Patch Adams and Bernie Siegel. And this year, for the year 2000, we have Dr. Andrew Weil, Dr. Oliver Sacks, and Lani Ali, who's the wife of Muhammad Ali, who's going to be speaking about caregiving. So we have a really exciting lecture series, and through the lecture series we try to bring experts in the field of healthcare and people who we feel could really improve the lives or teach people to improve their lives and improve their outlook in coping with illness. So Patch Adams was one part of our lecture series last year, and he talked about humor, and that was the purpose of his lecture. Was called Living Life with Joy. And it was really exciting. We had clowns there from all over the state. And I think it impacted a lot of lives. We had a lot of letters that came in afterwards from people all over saying how much they benefited from his lecture. So it was actually a 4-hour workshop about living life with joy. So it was wonderful.
I've had the honor, really, of making 2 introductions to speakers that Robert Wood Johnson Health Network hosted, Deepak Chopra and Bernie Siegel, and to see the people that come to hear the speakers, you know that their lives have been touched and changed in a very positive way by programs like this, and this one in particular.
Susan, how has this changed your life belonging to the Friends Health Connection?
Realizing that I am not the only one that has problems, and talking with the other people to know what they're going through, and if they're at a higher level than me, that I can be prepared for what might happen in the future, or vice versa, I can tell my friend to, you know, this is what happened to me. It might not happen to you, but with our communication there was a lot of preparation for, you know, like the way things would happen. And so, like, I feel it's a lot easier to cope since I know that other people are there.
Now, one last thing. Going back to your own life, you have won so many awards. You have won enough awards in a very short space of time, really, although I'm sure it wasn't a short space of time to you. But in years, it was a short space of time of President's Awards, of President Bush. I saw pictures of you with President and Barbara Bush, and all kinds of medals. How does it feel? Did you ever really think when you started this it would grow? I mean, we're sitting in this lovely office, and you seem to have a wonderful crew working here. That this would grow into this? And do you want it to keep growing? I mean, do you intend to carry it past Jersey into other states?
Well,
sorry to throw out such a huge question.
As far as did I think if it would grow like this, I thought that I would try my best to make it grow, to grow my ideas, because I really felt, and I've always felt, like when I was first diagnosed with illness, my question was, why me? Why do I have to go through this? And I've always felt that this organization is the answer, is my personal answer to that question. I've always felt that I got sick for a reason, and this was a reason to start this organization and to grow the organization. So I've been committed to trying my best to make sure that the organization does grow. And I think that's why we have grown so far, is because it's been a lot of work behind the scenes, but I've been committed to putting my visions into reality, because I really feel like I can make a difference, because I've seen so much and I've been through so much with illness that I really have wanted to make a difference, and it's been very, very rewarding. Every time I get a thank you letter, it's really incredibly rewarding and an honor to be doing the work that I'm doing. So I really love what I do, And my intention is to definitely grow it beyond New Jersey. And this hospital program that we're doing is really starting in New Jersey, but we've already been featured by the American Hospital Association and by a lot of different medical publications throughout the country. They've raved about the program, different publications have. And so my goal is to bring this to the healthcare community throughout the country. And that's what I'm hoping to do. And that's what I'm trying to do.
I hope you all found the show today enlightening and informative. I'd like to thank Roxanne Black and her staff and all of the guests who appeared on our show. They were just wonderful. I'll see you all next month. We have a great new show for you. In the meantime, take care.